First little bit of news. The approval of the April 12th minutes. I just noticed time differences. We really started at 9 instead of 9:30, and we ended a little later than was in there. So we'll just amend that. That's all I had to add about the minutes. Does anybody else have anything they noticed?
I'm not sure how I feel about this new font. Like, I really want to love Aptos, which is the default font. And I think I do, but it's just different. I'm a Times New Roman girl.
Yeah, despite the face time. I make a motion we approve the minutes as presented with the correction of time for April 12th.
Second, anybody?
Second.
Thank you. All those in favor?
Aye.
Okay.
Oh, wait, we have, sorry, we have, people who are remote, so we do have to do a roll call vote.
Oh, okay.
Kathleen, yes.
Jim, yes.
Ryan Romeo, yes.
Rebecca Joseph, yes.
Jordan Christian, yes.
That's Spears,
Dane Smith, yes.
Is there anybody else?
Oh, it's Jim. Terry?
Am I here for Dr. Westpizer?
Yes.
Then yes.
And, all right, and thank you so much. And Terry, I think, was a yes.
Yes.
Awesome,
Okay.
thank you.
Big head shake. Quarterly report, quarterly annual report. Jill, you're on.
It's under administrator.
Oh, so, so.
Oh,
So what has happened is it's a little bit beyond now just the nursing report, because we had started with the public health nursing program, and we've expanded into so much more. This is the annual report. So we have all of our Maven events, still the same. And then, you know, the addition of the wellness screening health education, that's on page 5 is when that starts. Kind of our car seat fittings. So we have now our annual amounts, which is going to be nice for comparison year over year. The car seat program, same kind of thing. It is split into car seat. And so that's when you install the car seat, or when you're giving a car seat and installing it. And then there's just the fitting, which we do.
Take that for inspection.
Inspection.
Yes.
Thank you. I will do that. So the next one is the agent inspectional services. This is just for the last 2 quarters. The numbers, like you'll see an asterisk, that's just because we're kind of fine tuning what we're tracking and really hoping that what it will end up being is good for quarterly reports. So for us, for our annual report, and then we do have it broken down by town as well in our back end, but you guys don't need to see all of that. And then our community engagement activities. And one of the things at the last meeting is we have a new community health worker, and we are so blessed that she is here today. So love to extend a warm welcome to Pam.
Hi, everybody. Thank you for having me here. Yeah.
do you want to talk a little bit about yourself at all? For those that don't.
I did write something up because otherwise my brain doesn't work.
Am I putting you on the spot?
A little bit.
I'm sorry.
I don't mind. So my main focus, you know, with the Southern Berkshire Public Health is providing access to and support to the South County communities. I've been, you know, attending meetings and community events and learning more about what the needs are and how we can help, you know, fit into that. Part of that has been with the 413 Cares platform. I've, you know, gone and received some training and am now able to present that to individuals, families, co-responders, EMS, law enforcement, and other local organizations, helping them to create accounts, claim programs, place referrals, follow up. And just confirm that this site is actually fitting what people are looking for. So if anybody's interested in a little service, I can do that.
Can you tell us about your language skills? Do you have Spanish at all?
I have a little bit just from, working within the community. I used to work at Mackey Pediatrics as a pediatric nurse, and also with TBI patients and things like that. So I do have a little bit of Spanish, but definitely not fluent. Thank you.
But Pam's been a great addition to our team, and we're really excited about the outreach that can happen, and so
Thank you.
so that's kind of what we did. This is our annual report. Yay. Okay.
Jane, could I put a couple comments about the report, if people don't mind? So I want to thank everyone for putting a comprehensive report together. It's been a little bit of an evolution since the beginning to where we are now. I know many towns have been asking for some type of annual report for their annual report that goes into, their booklets and whatnot. The report's quite comprehensive, and that entire report may not be suitable for like Sheffield and others whenever they get around to an annual report. So I don't know like how we can assist those towns, because I know Jane and I were getting bombarded with inquiries on helping towns put together an annual report so they can have it printed in their their booklet and whatnot. So but all the information is there, and I really love the community engagement piece. Well, like everything else, I love the nursing, the inspections and everything else, but the community engagement piece is a really good litmus test on some of the outreach that we're really trying to do, and I really see that really growing. Now all the staff's sort of in place, and Pam and Joe and Jane and Jason are hitting on all cylinders. I did ask the staff at some point, because there's so much community engagement stuff in there, to see if there's a way, and maybe ask for feedback for the group to see if we can maybe color code some of the kind of buckets of the community engagement, because there's a huge push for racial and health equity, access, we have the sanitation program, we have the community engagement, we have the nursing, and like Jane's doing a lot of the liaison stuff. So just if there are questions and feedback on these reports, please let the staff know. I think it's a really great report, and we're working really hard to really push that out, to really show people what we're trying to work on. And I feel like there's so much room to grow, and we're just starting to hit our stride now that the staff has settled in, and we're really moving towards that. So I want to just thank everyone for all their input on that. Thank you.
Thank you, Jim.
Can I just make a comment? Yes, a question. It occurs to me that while this is not the collaborative's responsibility, the idea of forming a more comprehensive picture of the activity in South County, for those of us who do not get our inspections through, some of the inspections through the collaborative, etc. I'm wondering if aggregating the report from towns that have independent stuff that they track might give us a better picture or a more complete picture of what's happening in South County.
The different towns.
Yeah, I mean, it puts more burden on us as individuals. I mean, we do have an annual report. We do keep track of things that we do, which augment what we get in the invaluable services through the collaborative. But I'm just wondering if there's a way not of incorporating them in, because it's not stuff that the collaborative itself is doing, but just to create a more comprehensive picture, if that's of use or interest. No,
I don't.
okay.
So I actually think that that's a great idea if towns are willing to share it with us. It's a lot of work, I think. So to do that, we would need to set it up and get buy-in from the towns. And if they're tracking it anyway, it might be really easy.
Right.
So
it's something to look
at.
into.
Absolutely. Yeah.
And this is on our website. correct?
Yes, I actually haven't put this particular one on our
But
website.
that's where it's gonna end up.
Yes, it's gonna be ending up, and we're gonna be looking at our new website here pretty quickly, so.
Yeah, I think it's a great idea. I will say, like if I just speak just for Tri-Town, I'll be honest with you, I probably don't work on the annual report until like January. Zach and I start working on our format kind of like late summer, and there's a lot that goes into that. And that would be up to every individual town to submit that. I will be honest with you, I don't track Tri-Town kind of goings on a quarterly basis.
No, I wouldn't suggest
Yeah.
that, Jim. I
Yeah.
would suggest it on an annual basis.
And I
Yeah.
wonder, like, if we got it, from the quarter, so if we all kind of made an agreement, what is in our quarterly reports, maybe that would be the thing, is then we could just pull it from the quarterly reports, and we would be able to capture that information from the previous year. So that we would kind of, so it wouldn't be the current, it wouldn't be the current year that we're in for like the annual report.
Until the end.
But once those come out, we could consolidate those as a point of reference for the fiscal year prior.
Keep thinking, so every town's services received through the collaborative is different. So the collaborative piece of annual report for each town is different.
Yeah.
So then I thought, if this is posted on the website, just put a link in the town annual report to go with the last thing
Yeah,
Oh.
yeah.
and all the details that are in it.
Yeah, that's a good idea.
That's why I asked if it was on the website.
Yeah.
Right, separate
Put it on the website.
for every town,
Yeah. For further information, please go to
all the details.
X, Y, and Z.
The deeds.
All right,
Thank you for that.
moving on, vaccine clinic schedule.
Yes, there's this little
Looks good.
handout in your packets, yes.
Looks
I'm
good.
sure they're all set. Did we get confirmation for voice and other? Nope, no, so those are the only two, but those are in November, like towards the end of November. But most of I think almost all the clinics have appointments set up already, so we're gonna at some point post. Are we gonna make magnets? What are we gonna do? I know we're definitely gonna advertise to get our clinic schedule out.
Hmm.
We are gonna go into the senior centers to help do on-site registration for those that have issues or don't know how to use a computer to make those appointments. We really want to get everybody, as many people pre-registered to help with the flow. So yeah, it's a pretty good schedule. We've scaled back a little bit. So yeah.
Have you opted not to use the MRC, but to ask for help in each of the towns? You were talking about how maybe each town trying to find their own help. What did you guys
That's
decide?
not what we
So
decided.
that just shifted completely into Berkshire Regional Planning. We haven't sat down with that man.
MRC is now in,
It always actually was. It was actually
okay,
through Berkshire Regional Planning Commission, and it was subcontracted out to Heather Barberry.
okay,
And then, so Heather was, and then
Yep.
there were employees.
yep,
So now, there's just been a big shift. And so, we have very specific needs, for us, what we need to really make it work for us.
okay.
And so we'll sit down with them, but we'd like to engage the different towns and invite board members. I really think that traffic flow person of just keeping things moving and being a greater, I think that's the perfect opportunity for boards of health to be visible and in their community. So
I'm putting shekels on it.
it's one of it's the emergency. Who's the guy that comes to the Southern Berkshire Regional Emergency Planning?
Matthew Bryant is the new MRC coordinator.
It's not too.
Yeah.
So, yeah, we had this, bit of this conversation, Berkshire County Boards of Health, taking into account. Sorry, for this last week, and that is awesome, so. Morning, I'm down with them, and they understand.
Okay, that's good. Thank you for priming it because,
Use
okay, right.
certain people within the FRC to fire out.
Okay. Yeah,
Things didn't work well.
we've had some issues, like the first year it was that, they weren't, anyway.
More focus.
Well, and then last year was the person who was working on it was good, but worked during the day, so only could respond in the evening. So those are the types of things that probably won't be an issue with them.
Okay.
So,
But you still use
yeah.
people that are members of the MRC. So say in our town, there's a couple of doctors that are still interested in doing this, continuing on helping. Mostly scribe, like Paula Corning, if I can remember. I didn't know if these people are gonna be boxed out because they still want to volunteer or.
here's a question for I think this is the perfect opportunity to have this conversation is, MRC really likes for people to, in order to volunteer for MRC, you have to be vetted and trained, and I think that that's really great. The question is if you have someone in our community who wants to help, because we're using MRC, can they still help without joining MRC? That's the question I have for the group.
Do you think they're qualified? Are you willing to accept them? Yeah, then
If
I'd
they
say
follow-
we have a mix like that.
Yeah.
I mean, I for one tried to volunteer with MRC. I went to some training, but then it's all out in the ether somewhere. I have no idea whether I ever really got licensed.
Oh, so what kind of, I get,
I mean, maybe that's good.
either that or they want out.
Yeah.
Well, and what ends up happening on our end, and it will probably be Pam this year, sorry Pam, is that you have then your MRC list and which changes, and we don't get notified of the changes, and we have our list. It's a lot.
I'll say we have time to work that out then.
Yeah,
I just didn't know, we brought that up once before and I didn't know where it stood.
I think keep working with it. I think with Matthew too, Matthew playing that.
Okay, great.
Extremely helpful, I don't know.
Good.
But
And I'm volunteering for Sheffield.
Excellent.
Put it on my calendar.
Noted.
Trial for the vaccine program.
Yes.
I just have one
yep,
question
sorry.
about the vaccine schedule. I know Pam, you had reached out about adding another one in Great Barrington. We usually have a vaccine clinic at town hall and I think I dropped the ball on scheduling that with you. We can definitely schedule, but just one idea I had is maybe looking or trying to look at one of the libraries. There's also a pretty big staff base at the Mason Library in between both Ramsdale and bless you, and Mason, and it's also a community hub and maybe more accessible than town hall. So we can, if you'd like to keep it here, that's totally fine, or we can maybe think of adding one in the library this year.
Yeah. So at the last meeting, so we were looking at our schedule and we were trying to consolidate. So we consolidated some schools, and one of the things is we looked at Great Barrington, and we were like, well, the Hoosey Dome is in an environmental justice block grant group population, which we need to make sure that we go there.
And it's a nice space.
And so we never actually, so there's a Hoosey Dome, we're doing it at the senior center, we're doing it at the school, and probably twice. One would be a weekend clinic. So at the last meeting, there was a note just saying, as part of the consolidation and making bigger, that was dropped off and they were listed. So we can talk about that, Rebecca.
Oh, and you know what? I didn't see there it is, Houston Tonic. 3 is probably fine, just.
Is that okay?
Yeah.
Okay.
Yeah.
Well, because we can talk about it. I know we never had a direct conversation about it.
I think 3 is perfectly fine and adequate for Great Barrington, especially since the larger one is also in Great Barrington.
Okay, great. Thank you.
Any other questions about vaccine clinic schedule? No?
Who went to childhood?
Yep, so VFC program, which is the vaccine for children, it's a state vaccine program. So we are part of that through the state. Our plan is, so as you see on our list, there's a back to school event. We are trying to plan a big back to school event down at the VFW. Trying to plan it in 2 months. We weren't getting a lot of feedback from local organizations. So one part of that was we were going to vaccinate school-age children to get them up to date because of COVID, things fell off. So the schools have been sending rosters, have been going through to identify who who needs vaccines. So that's the plan sometime in August.
Jill, have you looped in Vim on that?
No, why would I loop in Bill?
Well, because they have access to a lot of children. And their parents are always very interested in complying
Right,
with
so
that.
the letters will go out to the families. Yeah,
At the, those who are in school, but what about the preschool kids? Do we do younger kids?
we can, yeah. I'd have to reach out to the preschools. It's just the, so far I've got Southern Berkshire, Lee Public Schools and Berkshire Hills.
Right,
So,
so I'm talking about the population that is not yet in school.
right,
And who should have pediatric services.
Yeah.
But if they're getting, do they get shots through this kind of shot, vaccination now through pediatricians?
yeah,
Mm.
yeah,
Okay.
yeah.
Maybe they're.
This is to help with the load at the pediatrician's offices.
Okay,
So yeah. Yeah,
then they may be covered. It's just,
yeah, they may be covered.
frankly, it's just good to let them know what you're doing because they
Yes.
will pass it on in the appropriate language. to
We're,
their
yeah,
families.
exactly. We're gonna, send something out for the schools to send out during the summer that this can be happening. You might be getting a letter in the mail. You know, they can schedule an appointment with us.
But
Yeah.
sending that to the community health workers at VIM would be.
Oh, yeah.
Really good, then they can reinforce that.
Right, well, they would need to identify who's behind on their vaccines if they're not part of a school. already.
Right,
Yeah.
right, but
Yeah.
just to know in general,
Yeah.
because the parents may call and say, I got this letter, I don't know what it's about, and then they would have that information to say, oh, no, it's really important.
Yeah, no, we're gonna have a whole letter typed up and to go along with this. Letter that also that's through MIIS, which is the state immunizations database. That identifies what's overdue, what's due.
Right.
Yeah. So the big thing is kids that need their meningitis, so 7th grade, 11th grade, trying to get kids vaccinated for HPV, but then the other routine stuff that they're behind on. That's our goal, hoping.
Okay.
Hoping.
Special needs car seat program.
Yes, Pam and I went out Westboro.
Yeah.
Yeah, it was a 2-day program. Yeah, so it was for kids with special needs and these special car seats. So these big, huge car seats. So
Yeah.
kids like babies are in spica cast because they have hip dysplasia, or
Yeah.
kid that's got a broken leg, or they have low tone, so they're not able to sit up on their own. Kids who have, autism, don't want to stay safe in a car. Worked with all these big, heavy, expensive car seats. It was a good training. It's really good. What do you think?
Yeah, it was run by a physical therapist, the one lady, and the other one, I'm not sure what she was, but it was definitely very informative on, how it works, how the programs work, who orders it, who fixes them.
Okay.
And then for us to actually be trained to put these children in the car seats, in the car, yeah, it was a great program.
Where do you see yourselves going with this? Do you think there's gonna be a grant for us to have?
We will not buy
Wonderful.
these car seats.
Okay.
No, this is whoever fits these kids, they'll go to a clinic or whatever, and they submit the paperwork through the insurance company. We would then help the parents install it.
Oh,
Because where's the
Perfect.
nearest ones right now?
I don't know, probably Bay State, yeah,
So-
or Shriners.
Shriners.
Yeah.
So like for the parent who takes the car seat out of one car and then wants to make sure that it's in Jill's
Installed
car
in-
correctly.
Yeah.
We would
Perfect.
just,
Perfect.
Yeah, and then we're on a national list, so people search and find us. Yeah, they can find
That's
us.
lovely. Thank
Yeah.
you for doing it.
Yeah, next is the school bus training.
Ah,
Interesting. Speaking of that, like
Yeah.
transferring one car seat from one car to the next, is there a limit on how many car seats a family can apply for if they have 2 vehicles?
Mm,
Or
For the special needs,
No, for regular.
either both special needs car seats as well as the car seats that you would ordinarily install? Is it one per family?
so
Can
one per
grandma and
child,
grandpa get one? as
right,
well?
no, one per child for their lifetime. So, yeah,
Cool. Okay.
yeah. The state has really has really put the brakes on. You can't just give out to grandma, grandpa, aunt, uncle, everybody. So you'll fit. I'll install any car seat. If somebody brings me a car seat, I'll install it. So like I Head Start had me meet with some families. So yesterday, I gave a car seat to a grandmother because the car seat, she didn't know the history of it and it was ready to expire. So I was like, okay. And then this other mom, the car seat, I don't think she knew the history either. So I had a meeting with her and gave her the car seat for her 4-year-old. So yeah.
It's great.
Yeah.
Are you finding that families are learning how to check the expiration date too? Is that like an education?
They're like, oh, I didn't know it expires. Yeah.
Or like if somebody takes a car seat from a friend,
Yeah.
you know,
That's not
they're not
right.
asking, they're not asking questions like, what's been an accident? You know, did you pull the car seat completely apart to wash it? Because you're not really supposed to, you know, and, you know, going to the classes with Jill, you learn that like even the cup holders that are included with the car seats are part of the protection of the car seat. So if there is an accident, it takes some of the force, you know, things like that. I didn't know that. I didn't know that before either.
If there's removable cup holders, those are part of the car seat. They have to be.
Yeah, it takes some of the impact.
What's the expiration date? So some of nothing is uniform. So some of the manufacturers, it's actually on the label. It says the manufacturer date, the model number, what the name of the car seat, and it's on there. Sometimes you have to find it actually on the car seat. It's like embossed on it. It's like raised letters. It'll say don't use after 10 years or 6 years or 8 years. And then, so yeah, so whatever the manufacturing date is, like that year, it's either 6, 8, 10 years from that time. So, yeah.
And we also check on the national website to make sure that there's been no recalls on the car seats that they bring to us and also their vehicle, because that's part of the install. It's mostly providing education to the families.
Thank you. All right.
Hey, Jane, one question on the, we haven't talked to the entire staff yesterday, but Jane and I had a call with a stakeholder that is within the network with all the disabled families and whatnot. So when I get back from vacation, we're going to meet as a staff to figure out how to shore up, how to work with existing stakeholders and how we can outreach to those specialized families that may need this support. So Jay, I'm sure you'll update Jill and Pam on our conversation yesterday, but we're working on some strategies to work within the disabled family community to support them, because it's been tough to reach to certain sectors within South County, but now with Pam on board and everyone hitting on all cylinders, we have some really great ideas.
Back to school event.
Yeah.
Sort of cover that.
Yeah. We're gonna do the vaccines. And then the trainer Narcan training. So monthly, we have been meeting with Pat Tremblay from Pittsfield Health Department, Nancy Slattery, their new practitioner, what's her name? Oh gosh. What's her name? That's the
Gabby?
no,
I don't know.
no, who wants with the Alliance?
Nancy's the most recent one. I
Nancy,
can remember.
Leslie, and then they have a new person, I can't think of her name. Anyway, so we meet once a month to talk about, brainstorm ideas for, different, wellness screenings. And so one of the things we're gonna do is this, train the trainer Narcan training. So Pam and I, hopefully Jane's gonna go. There's gonna be a virtual, 2-hour class, and then there'll be an in-person. Then we'll be able to, some Narcan kits, get some training.
And on the Narcan, it's a good, Pam and I are on Tuesday, are meeting with, the guy from is it from harm reduction or BOPC? I can't remember, is coming in and, we're gonna look at the nalox boxes. And they have nalox boxes to distribute in all the communities. And so we're gonna find out what the process is. of like what, if a community wanted to host a non-lock spot, what those requirements would be, and then, you know, reach out to you guys to see if you're interested. You know, and it's interesting because it's good for everywhere. It's more populated areas, and then, I mean, Mount Washington, if someone overdoses, it's gonna take a little while to get up services, so it's an interesting thing, and we'll find out more about what that's gonna take and help facilitate that, if that's okay with you guys. Yeah. I think Great Barrington already has some.
Yeah, I have to check in with, I think his name is Michael, I'm not sure, but he was gonna put one up at Mason Library too in the foyer, and the only thing I know about it is that they completely service those no-locks boxes. So they'll go around and check themselves
nice.
to see if it needs restocking, so the onus is not necessarily on that building staff to send an email or give
That's
some
amazing.
notification, and so that I remember was a big roadblock to getting Narcan or no-locks boxes in buildings, and the staff didn't want to have to monitor that. So,
Is it something they would put in schools?
I think they would put it anywhere. So,
If you want to put it in an area where there's more access to it, that it's not closed up, like I'm thinking our library in town isn't open 7 days a week, and it has short hours.
yeah, some of the communities post it right outside the
Yes.
building.
Thank you.
The one that's sticking out to me is, so there's one at Leo's, which, you know, it's just like in the community area that access it.
You want to access it
Perhaps we'll have a
24/7.
field trip and see where that is.
Yeah.
I would
Yeah,
consider-
it's like there's 70 around.
Is it Springfield or is it Pittsfield?
No, I believe it's like Great Barrington.
Okay.
All right, we're on our field trip.
Want a field trip? Nice. All right, is that it from you? You think?
That's it from me.
Thank you very much, both of you. Moving on to agent inspector online permitting. Jason.
Yeah, so I'll start by saying it's been a busy couple of months. It's been a great couple of months. Jane and I have been able to pull away from the big housing case that was in Sandusfield and put our efforts towards some more needed things. So it's been really, really good. All in all, spending a lot of time in Sandusfield and getting that on track, and they're very, very happy with that. In regards to the online permitting with Sandusfield, it's gone off great. Everybody has used it plenty. Scott has also been using it. It's good to work with. And on that note, also we have Mount Washington's contract signed for permit eyes, and so we'll be working with them in the fall to get that implemented and underway. And that hopefully we go to Sheffield after that, so this conversation we had. So, but online permitting's been going very well. That's pretty much all I had for online permitting. I did want to briefly talk about non-complying septic installers. We had one issue closer to the time that I took this position, where a septic installer basically didn't pull any permits and no notification to us and put the system in very wrong. It took a lot of reeling it back in to get another contractor into the project, and the owners were very understanding. But I guess I wanted to maybe just start a conversation to see what we do when this happens in the future. Jane, did you want to add to that at all?
Only that same contractor was in a couple of other towns and was doing similar things, so you know, sometimes it's a one-off, you have a bad installation and it just happens. Sometimes there's egregious behavior, and so what we wanted to talk to Rick about is like, do we all want to know when there's egregious behavior of an installer or even a Title V person, and what would that look like? There is a BCBOHA installers policy. I don't know if it was ever sent out to all of the towns or not. It was.
No, we don't speak about that because we're having the same conversation. We'll be at the BCPHA meeting next week. on the agenda too.
Yeah.
So there is a procedure in place regarding the BCBOHA certification. So that's sort of countywide, all these installers come in and get their installer's license, do an annual update, there's some training there, and that's good. It doesn't mean they know exactly how to do it right, or they try to cut corners after they get it. So what it sounds like the issue is, it's when somebody does a subpar job in a town, how to, other than sort of gossip, how do we get that communication out to other towns? So last year there was an installer that we went through the process with and decertified him. There was enough evidence to do that, because obviously we want to avoid just complaints by maybe other installers. And he was issued a chance to show up and have a hearing and talk to himself, and he chose not to do that. So, but so I think the ball get dropped on how communicating that to the towns when it comes up. So we got to figure out what that is. Like, who's the point person to make the complaint to? Probably.
Yeah, I mean, I think doing a similar process with this group too, like if you're having issues with a particular septic installer, we should let the collaborative know so we can maybe move through an investigation / hearing to see whether, well, we wouldn't, maybe the hearing would be unnecessary, because what would be you deciding, but there should be some sort of formal complaint process or investigation. And then depending on what is discovered in that investigation process, the collaborative staff, sorry to put the responsibility on you guys, could disseminate that information out to this group. Because right now we're just using, like, if we don't work with the septic installer on a regular basis, we're putting a lot of trust in their BCBOHA license. And if they have that BCBOHA license, at least in Great Barrington, it's generally, if I don't know otherwise, it's good enough for me to issue them a septic installer license. So having that communication is really key. And the last thing I'll add is that at least on the BCBOHA side, with the new website that Matthew has launched, he has a complete list of all of the septic installers who have been issued that license on an annual basis. And I think if Scott help me, if the license has been revoked, are they still on that list? But it's specified as revoked, so you know. But that's one place that we can all go to double check to see whether or not they have a license, it's valid, and B, if there maybe have been issues in the past.
Yeah, we should make sure actually that the revoked name stays on there, because so it's revoked last year, and then doesn't get it for a year or two, and then applies in a town just as an individual license. That the name's successful. So there is a written procedure that we have. So we'll bring that up, get it out, and see what we need to do to make it better. I think through BCBOHA. I think that's the important, because that's where the certifications are. So we just need to figure out how to nail down the communication when there is an issue.
Yeah, we've gotten burned like 2 years ago in this kind of situation as well, with a illegitimate install. And so having more guidance on it and sharing information where you know to be suspected.
It's a shame it doesn't happen that much, but
Yeah, I was gonna say,
this really good.
it does not seem to happen often, and people generally want to be in compliance and do the right job, but we do have installers that we come across, and this was one of them. I will say I was a little disheartened when this situation came up, and I did call the BCBOHA, whatever was on the website. I was able to leave a voicemail, but got no response back.
Okay.
And granted, people are busy, I'm not saying, but I agree. I think there should be a better sort of communication to get that information out in between, boards of health agents and that.
Great. Yeah, that's why it's there. So great. Awesome. Start talking.
be involved in like getting those meetings, notifications for BCBOHA.
The hearing meetings.
No, just like.
Third Wednesday.
The third Wednesday.
But
that
Yeah,
sort of thing,
next, I think, yeah, next Wednesday. I'm not sure if Julia put it on the agenda, but Scott and I both asked her to continue that discussion for next week, so.
Okay.
So you'll get some answers even then.
We'll just continue the conversation and maybe update our procedures so we can have better communication, and I don't necessarily think it needs to be specific to BCBOHA, Scott. I think that, you know, if we had a similar process in this group, more communication, the better, because the goal is to kind of highlight awareness. But that's just my thought.
Jason, could I add a couple thoughts to this topic, because we've had a lot of septic installer issues at Tri-Town. So, you know, and we rely on BCBOHA to provide the certification, and that has come with challenges over the years because it's hard to get a hold of people. The installers don't get their cards in time. Then they come in the office, and we seem to be chasing them down a lot. And I think I was one of the originators to help move that policy along. I worked with Scott and I think Laura, because we had an issue in Lennox. And, you know, so we have to rely on BCBOHA to provide the certification piece. And so while they may have some power on revoking the certification, the jurisdiction still falls on us as the boards of health in our town. And so, like, one of the things that I've been trying to toy with some of these installers, and I think there's going to be more problems down the road than less, because we're seeing the qualified people that have been doing this a long time starting to taper off and retire. I'm seeing a wave of younger people that have zero experience creating a lot of problems. And so I actually think this problem is going to grow and not get less. That's just my opinion. And so, like, one of the things, I think we should have something for South County for communication when this stuff kind of happens, you know, letting people know. But it's really incumbent upon the boards of health to follow through on whatever action that they're taking. You know, like, if I have an issue with an installer, I don't want to just be sending out emails, you know, kind of scuttlebutt complaining that we've had an issue with an installer. If we're actually having issues with installers, it's incumbent upon us to take action on those installers, where it's a fine in front of the board of health, a hearing, and then kind of figure out a way to sharing that. Another thought I had is, you know, because most of us are online now for online permit and stuff, maybe we can have some type of affidavit, Jason, that can be part of our checklist, kind of attesting that, you know, has any action been taken against your certification by any board of health within the last 5 years. Make them attest to something in addition to their application, so we know. And then, but still, we still want to put pressure on BCBOHA to keep that list up to date. I look at, you know, we do the tobacco training, and we update our list every 2 weeks because we get so many requests. So it's incumbent on us, because the towns are asking us to provide the training for the tobacco clerks to keep up on that certification. Sometimes I feel like I go in circles a little bit trying to find information. And then when contractors come in, they don't get their cards. So we need to make sure that if we're going to require that certification, that we're meeting the needs of the installers and boards of health, because I don't want someone walking in my office on a Friday trying to pull a permit, and I'm spending 3 weeks trying to figure out where the certification card is. So I think those are some of the ideas. I think we should keep this conversation going. And I feel that there's going to be more problems down the road. I'm seeing tons of issues right now.
One thing I think is I can put the link of the installers on our new website, which we'll get to in a second.
I was just curious if homeowners have any kind of recourse with the bad install.
I think
Civilly.
Yeah,
I'm sorry, suing you.
Yeah. With the installer.
Yeah, that's what I'm saying.
So, Diane, I want to keep, it's up to you if you want to keep talking about this, because this is weird, but I don't want to diverge too much from the agenda, but I just wanted to update you on one thing that we spoke about at our last Great Barrington Board of Health meeting, was coming up with a procedure in lieu of a septic installer having a BCBOHA license, because as Jim said, there are more septic installers coming online now or coming into the Berkshires, whether they're just starting up or they're coming from out of Springfield. Yeah, and that's something that we're starting to see in Great Barrington, because the people that we normally work with are so busy, so homeowners are having to outsource. And so I'd love to get this board's thoughts on maybe what we can do in lieu. I think the Berkshire County Board of Health certification is a really amazing baseline. I don't want to replace that, but is there anything we can do in addition to or in lieu of having a BCBOHA license? And it's just something that we're talking about as a board. So maybe we want to have that conversation as a larger group, and we'll also be discussing it at BCBOHA too, maybe adding in trainings throughout the year, as opposed to that one annual training in January. And that's their one shot to get the BCBOHA license.
So I'm gonna ask a stupid question about being a health agent. Berkshire County has this. So say you're gonna get people from Springfield, but is there a Pioneer Valley? Or other organizations that do something similar to what's done here for.
Kind of similar, like FERCog has a certification process, but it's like you have to get letters of recommendation, and it's a much different process. It's not just going to the.
And do they have listings and stuff that you can refer to too? I mean, can you work in tandem with other groups further out as families are outsourcing for help? Is there a way for you guys, us to outsource information to bring back in?
What, Diane, if I can just interject. So I know a lot about the certification because Tri-Town actually created it back in 1994, and then we kind of handed off the BCBOHA. The reason why we put that certification program in place is because the state DP Title V code significantly changed. And at that time, there was a need of training, reading plans. And so there was none of that out in the old code. And so like one of the challenges with, and this is really for Rebecca and Scott to maybe bring back. One of the challenges with the BCBOHA, and it's just the way it is. You know, they still do the training in person. You got to sign up, and then they kind of do research and whatnot. I don't want to frame it as an exclusive program, but like say someone from Springfield wants to come in and wants to get certified, they can't because they can't get access to the initial BCBOHA training program because they only do it maybe once or twice a year now. So in a way, it kind of sets up the existing people to get all the work. And now, as Rebecca mentioned, I'm seeing the same thing, Rebecca, in Tri-Town. We're seeing tons of new people coming in. So what ends up happening is I get someone from Springfield coming in that needs to replace a system. They can't get access to a contractor. If we follow the letter to the law of the BCBOHA certification, we can't certify them. We say, oh, you can't get a permit. You have to wait. You get on a waiting list for BCBOHA. I would love to encourage maybe transitioning away from the in-person to more of a virtual class, where, in the technology is there. We do the tobacco training real time. People sign up, they pay for the class, they take the training, they take the exam, and boom, they get their certification. It's in real time. Now, there are pros and cons with that. There are a lot of people that don't have a lot of practical experience, for example, right? But they're still going to go into the BCBOHA certification, pass the test, and still go out in the field and do this. So it's not a be all save all system. But the way it's set up now, and it's not their fault. It's an exclusive program, and no one from the outside can come in and get certified until such time they decide to offer the class. So it's a bigger issue. And it's just, I would love to see more of these trainings go more virtual. Hint, hint, DPH, Mike Hugo with some of these trainings. The technology is there, folks. I mean, we have a pretty robust tobacco training now that anybody can access 365 days a year and they get access to it. And those that struggle with it will help them in person. I really see like some of this training moving in that direction, so everybody has access to. So it's just something maybe to bring back to the group and whatnot. But we need a system, because I really see many issues coming down the road with this. Because we're all getting older, and Scott and I aren't going to be around forever, and all the classic people that we trust and install systems they're aging out in the next 5 or 10 years, and we're going to have all these young people that may be great, but they may be lacking a lot of experience.
Yeah, I'm wondering if maybe Jason or I could go to the meeting on Wednesday to be part of the conversation, and then maybe have this be an agenda item for the next meeting. Does that sound like a good plan?
We all have lots of thoughts on it, so I think moving into the next agenda,
Yes.
we have a really great discussion.
All right. Is there any way to like team up these young guys with the older guys so that they can apprentice with them or learn from them more directly?
A lot of times that happens because the younger ones will work with the contractor for a while and then break off and go on their own. But probably better competitors, so
Yeah.
it doesn't really happen.
Okay. Rural recovery, 413 care.
Oh, so
card.
So that's the little card. Pam had talked about this earlier, and so we'll probably have
Putting them
more.
around. Right.
Do you have anything more that you want to say about it? No, I didn't mean to.
Not really, just if anybody's interested in doing the one-on-one training, I think this is that to help you, navigate the site. That's the best way to learn the site, to be able to.
Putting them in town halls, libraries. Or you
Yeah,
do this
I've got-
project?
there's actually some already around, but I definitely get some.
25 work planning.
Okay, so I don't know how much you guys want to get into this, but it was a pretty good process. On the time frame, I think we were the only group that had input by the boards the way that we did. So I appreciate everyone who came to the meetings. There was a lot of things that were changed and shifted, and so with your guys' permission, I'm just gonna kind of go 360 view or really high view, try not to get too deep. It has been approved, and if anyone has strong objections, then we'll resubmit it. How's that? So the first 3 pages are just public health grant requirements. This is all pretty much me. I have to attend grant meetings. I have to submit a list of y'all that are working with us. Maintain letters of commitment. Do our quarterly reports. We have an IMA, so we've already finished that. This is all stuff that was preloaded. So we're gonna be sending you a notification by October 31st, just saying, hey, here's, are you guys still participating? Here's what's required. And that we maintain Maven coverage, which is Jill and Pam. The second one talks about assessing and updating our existing introducible agreement, which I think we're due for next year anyway. So at some point we'll have that conversation around, all right, let's look at it, make sure that it still meets our needs as now that we've gone beyond the public health nursing. Going over the scope of service for us that we're providing you. We need to review the IMA expiration dates, submit any revisions to the program. And so those are all things that we're actually well ahead of other places. So that's the second page, housekeeping. Third page talks about the foundational public health services framework. That's something at some point we'll give you some information on and help you understand what that is. But basically it's a nationally recognized list of goals that boards of health will be responsible for making sure that they're doing or other people are doing. It's a statewide initiative, and that's more to come with that. Jill and I are actually on the groups that are giving feedback. What's that?
Advisory board.
Advisory board. So Jill's doing it on maternal and family health, and I'm doing environmental health. So that's happening. So that's all dealing with the framework, and we'll do that. The second page is sustainability objectives. One of the things that the state's really looking at is making sure that long-term, after these grants go away, that we can remain sustainable. So
they're going away.
In 10 years, yes.
Definitely.
And I don't know.
I don't know.
No. But we got, I mean, so, you know, things that we had to pick, it was a menu list. And it's like develop protocols for us to collaborate. You know, if a town wants to ask for us to help them, what's the process for that? You know, a streamlined approach that's easy access for all the towns. This is especially true of towns that we're not currently helping on the day-to-day, but if they have a housing case they need help in or something else along those lines, how do they access us? So the next C is developing a strategic vision and mission statement. So we have a mission statement. And so, but you know, look and see if we want to do a vision statement. Like, do we want to? And then the last one is develop language for boards of health to appoint PHE staff as agents, as well adopt protocols or when and how the PHE staff acts on their behalf.
Yes.
Yes. And I think that this also can go not just for PHE staff. I think, and there's been a couple instances where there's been conversation around, like, when you're an agent, what does that allow you to do and how to do it? And then when do you need to check in with the board? And so, you know, I think we'll do this for the public health excellence staff, but, you know, also just talk about it in general, because, you know, we have to keep things moving in between meetings, even within our boards of health. And we want to make sure that the individual boards of health are happy with that. One of the ways that we can do that is create basic language that we can all take back to our boards and have a common understanding.
Right, so that they understand what their role is and what the role of the agent is, and where the two overlap or where one reports to the other. Yeah, it's really going to be very helpful.
So that's that. Just since those are ones that we actually chose, are there any questions around that sustainability measure? Right. Then we had another sustainability objective. And this was around providing development trainings for staff and volunteers, right? Giving those opportunities out. We chose to collaborate with local pediatricians' office and schools to identify under-vaccinated populations and provide top vaccinations. That sounds a lot like what Jill's doing.
Yeah.
So
this is under the heading of diversification of funding.
This is under the sustainability. Sustainability. Yes. So we had to pick. This was the closest one.
Right.
Develop a targeted promotion campaign highlighting PHE programs. That is, we're going to be looking really quick at our website, and we are committed to working with hard to reach populations. So that, you know, getting the word out there that we exist, you know, make it so that if Pam or Jill or Pam call somebody and say, "Oh, I heard that you have Giardia. Are you feeling okay?" They're not like, "Who are you?
And how did you get my information?"
Okay, so that's kind of about just establishing ourselves in the community and buy-in of the force. And I don't really actually know why that was an option, but it was one of the options that was in there. So then the third thing, the performance standard objective. So we had to pick 3 of these, right? So if you go on the back, activity A, what we chose to do is focus in on providing services for Title V. And I know that it got truncated, so it's hard to see, but basically we're identifying areas of improvement for Title V and provide targeted training to enhance the effectiveness and consistency of inspections. So for Title V stuff, we wanted to conduct a review of the requirements for when someone wants to get a Title V inspection or installation, and just make sure that, that like when we are going out and doing a final inspection, for instance, that forms are available to the different agents of people doing that comply with the state. The next thing is, the internal documents, for Title V stuff, like when you do a plan review, making sure that you have a good tool that meets the requirements. Actually, Sandra Martin had come and I had come up with a checklist that I use. We want to make sure that all of the towns have access to that if they want to use that. So that goes back into the checklists. And then the other thing is create a kit. And we did. So, you know, for Title V, and then housing and also food inspections. And so any inspector today, we brought those kits for you guys. So, are there any questions about that?
I'm very excited about it.
All right. Let the minutes reflect that Kat's excited.
Sheffield.
Yeah.
No, it's awesome.
So the second thing has to do with the very similar thing, only with housing. So A is you know, making sure you guys are have access to the right forms and know how to use them. B is oh, that's right. The first one is like the complaint form and that process, making sure that that is something that you have access to, you know, the housing inspection forms, you know, any housing documents like draft letters are always nice when you go, you don't have to reinvent the wheel, and then giving municipalities some tools for their housing inspections. So that housing.
I can't tell you how important, I think everybody here knows how important this stuff is and how helpful what you're doing is and will be. It's just invaluable.
Thank you, Pat. Are there any questions about that one? All right, trying to speed through because I know this is a lot of information. Okay, so the third one, which was also required, was they highly encourage tobacco use prevention. So this one's kind of funny in that they're like, the only thing we're really committing to is we have to contact the staff and ask, and the local access tobacco awareness program coordinator to discuss opportunities to improve tobacco control. And then B and C are additional activities to be added following that conversation. So I think that's covered. Yeah, we're covering that. And
is there anything that in this particular one that might lead to opening up the membership of the of the tobacco thing, yeah, to other towns?
Well, I'll let Jim talk about it. I'll let Jim talk about it.
Yeah. So so the RFR, which is the reopening of the bid for the tobacco programs, is probably going to be FY26. So the answer is no. So, but how can we support towns in the interim for that? I think we've solved that. And so probably sometime in FY25, they'll probably post that bid. And of course, Pat, I'll be coming to Sheffield to ask for a signature to join the program.
Right.
Yeah, so it's right now we have 14 towns. It's, you know, it's county-wide, but it's only 14 municipalities because the way the RFR was designed, even historically, is you got to have retail stores. You know, it got to have retail stores. So there's towns that don't have any. And so it doesn't make sense to sign on to that. And I know there's some long-term vision how tobacco control is set up with respect to the public health excellence, because the whole point of tobacco control, and I've been doing this for almost 30 years, is tobacco control was created because towns didn't have capacity to enforce tobacco. And there's a lot of work that goes into tobacco control with training and understanding that many towns just don't have the capabilities and incapacity to do. And as we increase capacity, what does tobacco control look like long term? Is it still going to be a separate program? Will be infused with PHE? No one really knows, but I've been trying to encourage the state to think about that. I mean, I don't foresee having multiple Board of Health funded tobacco programs in Berkshire County because it's not efficient. It's really a part-time program, to be honest with you. We need more funding for it if we really want to do a lot of work. So the long answer, Pat, is which just get through, support Sandusfield, Sheffield, and New Marlboro the best we can with maybe some soft inspections, kind of document that into the post system, give them the regulations, give them the updated letters on the banned products, kind of support them as much as we can. If any of those towns want to work on regulations now, I will help you do that. I will support those 3 towns on updating and creating regulations, because all 3 of those towns either have nothing locally or it's so archaic it doesn't even make sense. I can easily help your board between now and then to draft regulations for your boards, but it's complicated because it's a contract. It just can't be reopened with a couple of years left, and I find it unfortunate because the CART and PHE has determined tobacco control to be a very top priority, as it should be, but there's not a lot of funding out there for those non-funded tobacco program towns.
And you guys aren't, hi, everybody. You guys aren't alone in that, just so you understand that this PHE program was kind of dropped in as an overlay long after the tobacco programs were set out across the state. So we actually have some PHE groups that we're working with that have, in one PHE group, there's 3 different tobacco collaboratives that happen to overlap into them. So it's a mishmash mess right now. And I think what Jim was just saying is probably going to really be what happens is that the next time that the procurement comes out, and we can't get people into it. We've tried to get some of the groups into it, but you can't touch it right now. So next time it comes out, I think that what we may see is that the tobacco districts will be formed to overlay exactly where the PHE districts are, and then following those borderlines, and then the outliers will just have to be claimed by somebody somewhere, because there's still 20 cities and towns that don't belong to the program as we sit here right now. So, or 30, I guess, 30.
Yeah, and tobacco control, it's not mandatory. The thing that I struggle with tobacco control is when we get a new RFR, some towns sign on, some towns don't want to sign on. It's free funding, basically. It's free funding to help the stores get education, enforcement, obviously, and everything else. And it's while it's probably part of a performance standards, towns are not required to opt into the tobacco program, which I find it unfortunate, actually, because there's a lot of issues with tobacco control. We're still seeing tons of black market activity. And then we have towns that are part of a tobacco program that aren't doing any enforcement capabilities with that. So it's a challenge across the board. So I hope DPH works with all the boards of health to kind of reset. We have towns across the state that stores are selling, for example, and they're not even doing the minimum enforcement. And so there needs to be a little bit more work on that.
Thank you, Jim.
Okay. Moving on.
Yes.
All right, so so the last 3-year elective, why would we put more on our plate? It's stuff that we're doing already, and that this lets us now pay for it with the grant. So, Jill stuff, car seats, CPR classes and choke saver courses, and then a community of practice meeting, and we're saying that we'll do that. The next elective is around education, training, and credentialing. So we're going to document all of our progress in making minimum standards. I know that's something we talked about, and And then also, for those of us who have worked in 7 years but don't meet our requirements for our current job, we're gonna help get a waiver put forth. They really don't want to lose public health people. And so we're really gonna push that hard. So that's something we're gonna be working on. Helping everyone get onto Train Massachusetts, and also just having established specific times when we're available to the town, so that it could just be like a drop-in, or you guys could call during that time and you would always know that would be available. That would be nice. I think it was your idea. But that would be, it is nice there. We are always available. I gotta call at 11 o'clock. All right.
It's nice to have
Turn off your phones. Yes. And so then the last thing has to do with chronic wellness clinics. And so that's something that we're developing right now. So quarterly programming on top of our wellness clinics, right? So we'll be talking about.
So you need to change the sessions, not clinics.
All right.
That's that wording. Let's be change the sessions.
Sessions, got it. Screening. Screening, okay. And then developing programs for people who are high risk. So like file of life, for instance, doing home visits, possibly for fall risks. You know, the lock zone training and distribution. And so through having this in our work plan, now we can use this money to do it. And then community navigating in the forum. So that's that. And it was a group effort. It's a lot of information.
Excellent.
And and it's been approved. Unless someone has some major issues, then we'll just go with that for this year. And
thank you very much for all that work, because that was a lot of work.
You know, that's a lot of work.
So we have a new webpage.
Yep, we sure do. I am very interested in you guys going on and looking at this. Here is our website. There's actually, so there's this. So this is what it actually is right now. And we didn't like it. We were like, that is so many trees. It doesn't say what we're doing. There's no, yeah. No, and it was like, so we've been talking, but it does have all the information. So I'm going to show this to you first. And then we'll go and,
you forgot leave there. Sorry.
What's that?
I look at it all for the Great Barrington, and I see these below.
Yes.
I go through the list and
and you know, I can ask Jim about that. I also like to do it alphabetically, but so we'll have to talk about how to handle Tri-Town. So we have our mission there. We have a description of like the different towns, when we were formed, and you know, under what pretenses we were formed. And then this is looking for more information. So if you click on Great Barrington, it goes right to the Great Barrington Board of Health website.
Nice.
So that we are able to.
Nice picture.
Yeah, it's a nice picture. Oh, there we go.
I must have a good night's sleep that night.
So, and the thing that we didn't like is then, so now here's the beef of it, like the news and announcements, right? That's really what people are going to our website for. And so we're trying to figure out how to get that up. But the content is still the same. We went and we put the ice cream recall stuff on there. You know, our fall and flu COVID vaccine clinics. You know, if you click on it, then it gets more information. Our sharps disposals in South County. So, you know, here's just a resource.
Nice.
So there's that. And then the other piece that we want to hire is, so these are the 3 sections. Remember, we built it off of someone. There's environmental health, food safety, and public health nursing. We'll go into the public health nursing because those are our superstars. And, you know, there'll be information there on our different programs. This stuff was just wording that we kind of threw together. AI did, yeah, AI was involved in the first part.
It's okay.
It really is.
Sometimes there helps.
And so sometimes we're going through them. And so I would love it if you had moments and you just wanted to scroll through. We want as much feedback as possible.
Okay.
I will tell you, I have really gotten on the AI lately. I made this beaver picture by myself using AI. And that's really the only one I've done like a deep dive. It's adorable, right? Yeah, no, we even actually have a song about Southern Berkshire County written by AI. It is hilarious. But we're not doing that today. So I know, I haven't gotten a good tune yet, like the chords for the ukulele. So this is we've been having a lot of questions about beavers in a couple different things. Okay, so this was our first deep dive on that. So, you know, we can do beaver removal, we can do breaching of dams, right? We can, the Conservation Commission must issue an emergency certification, and also for installation of water flow devices. Contact your Board of Health to find out what form they would like for you to use. And then there's some resources like preventing conflict with beavers. I think this is a Great Barrington link. Thank you, Great Barrington. Oh, no, it's not, but there are some, I've been pulling it from different. So that's kind of the goal of this, is to have that for each one. So then there's these quick links. So we have our public health nursing initiatives, and it's going to look very similar to what we've already seen. Our environmental health, which we've already seen. We haven't really built out the food safety piece. This was written by our web developer, Guardians of Public Health. So we might keep that language. We might, we'll get Jason with like a super
now. His sword in hand.
We're having wings from the back of our shirts.
Yeah.
Yes, that's what we're gonna do. So that's the kind of thing, information about our vaccine program, and then our staff directory. So obviously we're in the progress still. It's been, you know, it's been a group effort to kind of get that to this point. And so you'll be seeing this develop. And then at some point I'd like to go to the boards of health and say, all right, here's what's available. Would you guys, you're welcome to get your beaver section. If you don't want to have your own beaver, you can link it, right? Just more information about beavers in addition to what you have. And then the other thing that is not developed in here yet is our resources will be eventually put in there. The log that we log in, and we can have resources like enforcement letters and things that aren't really for public. We haven't quite gotten there yet. So that's what it currently looks like. And then this was problem solving. We didn't like the calendar in there because there was no calendar. So, you know, need to reach someone, contact your Board of Health. I have no idea what's going to happen when I think about that. So we're trying to figure out how to bring everything up. And so, again, if you have comments, I can put out when it's revising. Anyone who wants to do that, I don't know if you guys want to have all volunteer, like a small group of people saying, hey, we just updated the website. What do you think about this? We could have opportunities for this group to do that. So it's a work in progress, but I think we've made a lot of progress.
It's impressive. Thank you.
Did you work the website currently, or is there website manager that make changes?
Both. Jason and I will both be able to do it. We're learning WordPress.
Oh, okay.
Yeah. So it's a new skill. So we put on a resume, right, Jason? Sure.
No, because nobody's going nowhere.
We're not. I hope I could speak for myself. I will cry for days.
Any further questions on it, or any more explanations?
So please give us feedback. We want, you know, if you have something on your website you really think is great worded, send it to me and we'll just plug it in.
Okay, well done, Jane and AI.
Yes. It's impressive. It's impressive. Okay, moving on.
I was like, beaver with dam. So that's the webpage. I just want to make sure you guys have access to the letters that came out.
Right, for the tobacco, emailed us, yeah.
Any towns that want help, you know, getting these out, basically it's, one is the flavored tobacco. There's, non-menthol greens that are actually are menthol. Apparently you can't just put non at the front of like a banned product and, so. And then this is, I think, the CBD and THC in food is something that we're gonna keep seeing, and I feel like at some point we probably want to, hopefully we'll have some trainings on it, because I mean, you see it everywhere. So,
Can I just
yeah, please.
offer like a really quick food for thought comment, with the grocery stores that had those products on the shelves, they were so quick to comply, they really got it, but, one thing one of my board members brought up was how do we handle like farmers markets or temporary food events where these things are popping up, and it might just be harder to catch when we see it on these temporary vendors.
So, I got some feedback, Rebecca, on that. So this has been a struggle for a while with the CBD stuff. You know, the CBD and vaping and that kind of stuff is kind of falls under, you know, tobacco control. We have that kind of sector covered. But when the Department of Ag put out those policies a while back, 2 or 3 years ago, maybe even right around the time of the pandemic, they put all the roles and responsibilities and onto us, right? Where we're like, or what do we do with all this? And there's CBD stores out there. There's stuff everywhere. And so like what Tri-Town does is we really try to enforce the CBD in food, you know, farmers markets, restaurants, things like that. But there's a whole sector out there that like we just don't have the capacity to deal with. I mean, there's a CBD store in Pittsfield. There's CBD gummies everywhere, and it's like it's a really hard thing to wrap our heads around. And I know that the advisories keep coming out, and the Department of Ag says Board of Health enforce this. It's really hard. We'll try to stop any like farmers markets or, you know, temporary food permit folks that have anything CBD infused in food to try to comply, but we can't. There's only so much we can do too.
Thank you, Jim.
Good question. So,
yeah,
it's real basic. So it is illegal, but it's not approved, but CBD.
Unless plus, like if you have a license to put THC in food, would they have to be sold in dispensary?
That's how I read the document, is that CBD in food can be sold at a Cannabis Control Commission licensed dispensary, but not at a food establishment.
Yeah, we can THC. That's under cannabis control.
Right.
Completely.
Another funny question, well, not funny, but interesting question I got was, what about CBD in dog food or dog treats, plant treats? Yeah. And I just kind of went out on a limb and said, well, that's not governed by the food code, so I think that's okay. But that's how I answered that question.
Yeah, they do like
yeah.
Yeah.
It's gonna be the new black market fighters.
It's your dog, for your dog, or soda for your dog,
for thunder soda.
Yeah.
So there's a lot to learn about that, and I think the state's gonna be really slow in getting out actual useful information for us because it's cross-jurisdictional, so that makes it even harder.
Good point, Rebecca.
And that's the shared services manager staff update.
Okay. How about new business? About that.
I've got the log.
Yeah.
So I did want to let you know that I'm part of the CHI initiative. It's a group of community leaders in Berkshire County, the hospital, BIM, Berkshire Regional. What is it called? It's called CHI, Community Health Initiative. And so they, because we participate, we got a $10,000 grant.
Oh, thank you.
And so that would address one of the issues that we're looking at, which are decreased isolation, better office encounters is one. So anyway, it was very quick and we had to put a proposal in, and so the proposal is to help increase people's access to the outdoors. And so follow me here. Yep. One of the things that is a barrier for people spending time outdoors is ticks. Yep. And so we've been working actually, Mike's still on? No. There's an expert and UMass has experts, so we're thinking about bringing in some tick education. I haven't shared this with my team yet, but maybe like a little video that we can put up on public television.
AI. I was gonna say not it.
So you how to check yourself for ticks. There's actually some really good things that are already out there. Use our website. And then last week Pam and I were looking, you know, there's the tick twisters, which are okay. There's the tick spoons, which are nice. But we're talking about the outdoors. And so when you think about the outdoors, you need something that's more readily available. So there's this tick key. It can go right on your keychain. It can go on your dog's collar. And so we'd like to purchase those trailheads for all the towns. So we'll be reaching out to probably the health departments and then get access to the different trails in town to get signage up of check yourself for ticks. And there's a group, it's the Central New York Lyme Alliance, and they have a lot of stuff that they've already done. I can pass along, and then there's another organization that I've been put in touch with. So we'll be developing those signs, and then so education, tick keys that are portable, and then I'm in love with these tick mitts. I don't know if we're gonna have enough money to buy them, but it's a glove that when like you come in from outside, and you rub it all over you for your dog, and then it comes with a mesh bag, and you throw the bag and the tick mitt in the dryer for 10 minutes, and it kills the ticks.
Oh wow! So is it a magnet? Like how does it?
It's microfiber, and it just hooks onto those little legs. Yep, it's on there, and
it's reusable.
It's reusable. And there's different colors if you wanted to have one for you and one for your dog. But so anyway, we'll see how it's something I'm really excited about. I live on a farm, and like I think I just want a free tick mitt. So we did talk yesterday at yesterday's meeting. I don't want to just give these things out. I'd like for there to be an educational component. So like come and learn about ticks, you know, or watch this video and you could go to and come pick it up. I just want the educational component to be part of the Sheffield Fair. The Sheffield Fair might be something. That's rest of the Apple Street last time we met. So we could maybe table some events. Yeah. And you know, Jamie Zapata, who's hilarious, if none of you have worked with her, her suggestion is that before you get a free tick mitt or tick key, you have to demonstrate you know how to use it.
And it's not a beer can opener.
I haven't tried yet. So anyway, I wanted to let you guys know that happened. And
that's an idea. It has to be a dual purpose thing. So a beer can or bottle opener and tick removal.
One of the high initiatives is to reduce the incident of drinking in adults. Darn it. But yeah, I like. And then animal inspectors. There's several towns that with Cassie leaving. And Great Bear and Sandusfield also lost their animal inspector, and so it's a need. It's actually a responsibility of boards of health to make sure we have an animal inspector.
I just found out that a police officer in Sheffield has agreed to this added responsibility.
That's amazing. Yeah, usually people don't.
Is there any way to have shared animal inspectors for smaller communities? I know
there is a way, and I think before Sheffield found their own Sheffield, something like we had reached out to some of the towns to see, like Sandusfield very open to sharing it with another person, another community. The key being that it can't exceed that 19 hours because then it becomes so much more expensive. But like one of the issues with having animal inspectors and animal control officers is that, one is that many towns don't pay enough to make it worthwhile to be on call 24/7. And I think that pretty much sums it up. Yeah. But yes, and so if any town, so Mount Washington, I think, is Mount Washington without one? I think so. Sandusfield is without one. Sheffield's covered now. New Marlboro, do you guys have an animal inspector? Okay, so maybe we should put the two of you together and.
Jake, could I throw a couple comments in about that? So and Jason's our animal control officer. So thank you, Jason, for taking that responsibility on. And so we've talked to Chris Ketchen about this, Mary Beth, and some of the other town managers. You know, there are some positions in towns that to most people aren't super important, but they are when they're needed. Animal control is one of those. Lee and Lennox has a shared animal control and a shared animal inspector, and we're very fortunate that we have a veterinarian doc who gets paid very little money to help with like some of the bar inspections and supporting Jason. And we're very fortunate when we had a vacancy a few years ago that we had an existing Tri-Town employee take on that stipend. But we also have a very strict protocol because there's limitations on the animal control position. It's not 24 hours a day, 7 days a week. We do the best that we can, and we have to rely on police departments and off hours and stuff. Has Jason responded off hours? Sure. But it's a position that it doesn't get paid a lot, and there's so much responsibility that goes with that. And I think that whole thing needs to be looked at. And, you know, I don't want Jason to ever give up animal control, but if that ever becomes vacant again, and when our veterinarian fully retires, we're going to have a problem filling that position because of the pay and the responsibility. And I think at some point we should kind of put our thinking caps on, figure out how we can make that work. You know, just similar to like weights and measures. Like nobody even knows about weights and measures, but it's really important. And it's not a lot of work, and you got to be trained and certified to do it. And so no one ever thinks about it until it's needed, and then there's not enough resources to cover it. And that's a problem across the board with animal control. And animal control, the laws have changed, and you got to have certified animal control officers now, in which Jason has to attend 15, 20 hours a year to keep the certification up. But we still struggle a little bit at Tri-Town with the expectation of a part-time animal control. And Jason does a fantastic job. You know, he uses his own vehicle, but we don't do roadkill. It's domestic animals. There's only so much we can do. And at some point, we're going to want to pool our resources together to figure out how to make that sustainable. Just my thoughts. And Jason, I don't know if you have anything to add on that.
No, you actually already had said it. I wanted to remind just to say that the state is requiring animal control officers to be certified, to go through a certain number of continuing education hours every year. And it's not a straightforward, easy position by any means. And yeah, like Jim had said, it's very important when it's needed. It's not always thought about when it's not needed. But I'm glad I have a position. I've learned a tremendous amount from it. And yeah, I certainly do think there's conversation to make it a shared position or broaden it somehow.
And in the scope of minimum requirements, animal inspector, which is different than the animal control officer, is required, is a minimum standard by the Board of Health. So it does fall within this arena, the animal inspector part of it, which with bird flu and rabies, you know, those are the primary things.
Okay. Upcoming trainings.
So you all get the MHOA list of training, so I didn't worry too much about that. But the MHOA conference, the early bird is open right now. So if anyone thinks that they're going to be going, it's in Springfield, so you don't necessarily have to go overnight. You can go for one day. We're going overnight, and we'd love to have some teamwork, team building activities. It's actually later on now, it's in November. Yeah, it's different this year. It's in November in Springfield. And so some of those issues like CBD, we're asking Cheryl Savaro to come in. And I believe it is.
And the collaborative is not paying.
Yes, so the collaborative can pay. And so if you want to do it, the easiest way is to just, when you register, put the collaborative and then put pay by check. And then we can get that, and then we can pay that invoice. It makes it a lot harder when you pay, because then we have to reissue it to Pat Levine or, Rebecca Jerson. But, while some of us will miss the Cape, I think it does offer an opportunity for Western Mass folks that don't necessarily want to stay overnight to go.
It's an easier.
Is there an agenda published yet?
We're still working on the agenda, so the answer is no, but it's pretty far along. So if you feel like you want to pick one day, I could share that with you. I'm on the advisory committee, so I could share that with you if you wanted to pick which day.
Yes.
Okay. See them. Perfect.
What were the dates again?
Oh, I'm gonna just search it. MHOH.
November 13th.
Yes. Which is for those of you who are involved in, is Ellie still on? No. With,
Yeah, she
it's,
no.
it's the same exact days as the FDA conference. So those of us who have, need to go to the FDA conference to stay current, won't be able to do both.
I'm here.
Oh, you are? Okay. Hi, Ellie. You won't be able to go to both.
Oh, okay.
And that's all I have.
Okay. Anybody have anything else to add on an update? Anybody?
I do.
Okay, Rebecca.
Maybe you saw it in the press release that went out, but we've hired a new health inspector. He just started this Monday. His name is James Massey. He comes from the food world. He's been a chef, private caterer for a number of years. And then also excitingly, he's a Great Barrington resident. And this last week, he just did marvelous. I'm really delighted to have him. So he's off on Fridays, but if any of you want to stop in the week and introduce yourself, Chris, learning a lot and love to meet everybody.
You must be thrilled.
I am thrilled.
Oh.
But I'm also glad that I waited for the right person. It's really great. So.
And Rebecca, if you find that you need any help, we are here to support you guys in whatever way. I just wanted to say that.
Thank you. And that reminds me also, speaking of training, earlier on the train accounts, minimum standards for Board of Health staff. I think one of the meetings we talked about maybe getting a list of what those trainings on Mass Train might be, but we've been using that for James this last week. And I've just been piecemealing some trainings together that I think are relevant. So if there is a list that health inspectors are required to take, the OR, Office of Local and Regional Health training, just if you could email that to me, that'd be good, so we can have James chip away at that.
But I think also on that, it would be interesting for boards of health to have a list of basic trainings that their members board members would benefit from, while not perhaps required. But
so one of the things in our work plan is to set up training accounts for anyone that wants one, and then we can pre-populate a list, or teach you guys how to pre-populate a list. So that's definitely something we can work on.
Right. Yeah. But yes, we will be reaching out to you for at least some shadowing opportunities for James, if that's okay with specifically tobacco that came up this week that he's really interested in learning how to do. So we could shadow someone maybe from the tobacco collaborative as they go on a compliance check. I think you'll find that helpful.
We can ask the tobacco Jason's also doing some tobacco education, so.
But the shadowing might be better off done with Kate. Who's the, tobacco, enforcement board. I don't really know.
Yeah.
But would be, probably more than that, we could coordinate that.
Right, thank you.
Yeah, Rebecca, just have James reach out to Kate. You should have her email to coordinate some retail inspections and whatnot. We typically don't do compliance checks right now. We kind of come out of the gate, the new fiscal year with education stuff. But Tri-Town has always had an open door policy of bringing anyone in to shadow. We do tons of stuff. We've worked with other towns before. So he or anyone else is welcome to coordinate with Jane, Jason, Zach, John, Ellie. They're welcome anytime to shadow us. It's the more practical training and support we can give each other, the better off we'll all be.
On that happy note.
I will be.
Yeah. Next meeting's October 11th. And somebody has called for the meeting to be adjourned.
I second.
Thank you. All those in agreement? Yes, out of here.
Thank you,
Aye.
guys.
Thank you.
Nice to see you, Terry and Mary Beth and Ellie.
October 11th.